Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, treatment of diabetic retinopathy. So, in the treatment of diabetic retinopathy, first, mild to moderate non-proliferative diabetic retinopathy. If the patient has mild to moderate non-proliferative diabetic retinopathy, follow-up is advised. Then, if the patient has severe non-proliferative diabetic retinopathy, in this we should ask the patient to strict follow-up should be done to see whether there is any progression to proliferative diabetic retinopathy. And in high risk cases we can do pan retinal photocoagulation can be done for high risk cases. For high risk cases we can do a pan retinal photocoagulation can be done for high risk cases. Then we have treatment of proliferative diabetic retinopathy. Proliferative diabetic retinopathy can be treated actually by pan-retinal photocoagulation can be used for the treatment of proliferative diabetic retinopathy, and we can also treat it with pars plana vitrectomy. In pars plana vitrectomy is actually done when there is retinal detachment or if there is any vitreous hemorrhage. If the patient has persistent vitreous hemorrhage or if the patient has retinal detachment, in such cases the diabetic retinopathy, you should do pars plana vitrectomy for proliferative diabetic retinopathy.
thank you and thank you for watching.